Keeping ahead of cybercrime and protecting essential medical records has never been more important. NHS Services spends considerable time and money trying to supply duplicate records securely. Scan and Collate provides a mobile service that streamlines this process, and here's how it's making a difference.
It's a busy day at this GP practice in Kent. From babies to pensioners, we all have a medical record.
Hello.
Among the visitors is Scan and Collate. They visit hospitals and GP surgeries to scan the medical records of patients that have been requested by agencies such as lawyers and police.
Before we used this service, we used to send a physical copy of the notes to an agency when requested. We had obvious worries, especially in terms of security of the data. Now we know that we can have confidence in when the records are sent. They're sent by an encrypted CD, so if they are lost or someone intercepts them along the way, we can be sure that they're no good to anyone.
None of the data leaves the building. It's never saved on a server. Recently, the Health and Social Care Information Centre created an emergency response team to help NHS bodies affected by cybercrime.
So there's more and more cases of cybercrime happening, but what happens if the CD falls into the wrong hands? Well, let's take a look. As you can see, this is protected by a password which only the recipient has.
The password is sent separately on the invoice.
If the requester phoned up the practice saying, "I've got the CD, thank you, but I've forgotten my password," rather than give that password out to somebody who they're not sure should be having it, they can just say, "Well, it was on the invoice we sent you."
Scan and Collate visit once a month. On average, it takes 25 minutes to scan a record.
Well, just look at these ones. These are a nightmare because they're all folded so tightly in there, you can't get them out. Well, we see, it's patients' records, and we've got the little cards. They've all got to be photocopied both sides. That takes time. Often there's things stapled to the back of these cards that need to be taken off. All time consuming. All when I've got a staff member, we're only a small practice. Really, I need her doing other things.
A record this size would usually take the practice half a day to photocopy and put back together.
With those records, I could scan, take them apart, scan them all and then put them back together within 40 minutes or so. Then it would take a couple of more minutes to make a CD, and then that will be that record complete.
Staff are under increasing pressure to deal with patients. Sandra Holland's time used to be taken up photocopying documents.
It was quite a boring part of my role. But as I say, it just took so long to do. Some of them are really big, but it's lovely to know that I just have to copy off what I need to, and it's all done for me.
The largest record that we've scanned was for a large central London hospital, which was 12,000 pages for one patient record.
And how long did that take?
It took about a day and a half for us to do it. It would have taken them probably close to 2 weeks to actually do all that amount of work.
The company began in 2007 and covers England and Wales. All the staff are trained to be as efficient as possible.
We don't use any temporary or agency staff, which means all our staff are on permanent employment contract with us, and as such they've all been reference checked, they've all signed a confidentiality agreement as part of their employment contract, and they're all CBR, or the newer ones, DBS checked as well.
I'm confident now that we're the guardians of patients' records because we've got this role and it's entrusted in us that the records that leave the practice are being handled in a correct way. If the disc goes missing, it's encrypted, so we can just have another disc printed off and it reaches its destination safely.